Welcome back. Today I'm joined by Lima Memorial pulmonologist Dr. Jason Stienecker to talk about some very impressive innovations Lima Memorial has brought to the community to impact the fight against lung cancer. So locally, I understand we've made a lot of strides in diagnosing early stage lung cancer. Can you talk a little bit about that?
Yeah, absolutely. So starting when I got here in 2017, we started the program to look for earlier stages of lung cancer. Because as you diagnose advanced stage lung cancer, the chances of cure decrease significantly. So we brought in navigational bronchoscopy, ultrasound guided biopsies, as well as looking at smaller and smaller nodules. And so since we've been here, we've been able to increase significantly the amount of low dose or the amount of low stage lung cancer over the past few years. And we're upwards of 30 to 40% low stage lung cancer, which is very high in the nation. And Lima Memorial has actually been designated as a center of excellence for lung cancer, the only one in the region.
Interesting. And what results have you seen in diagnosing early stage lung cancer?
So once we're able to diagnose an early stage lung cancer and do it very early, patients get cured. And there's a 93% cure rate when we look at stage one. At the smallest stage 1 lung cancer. So we've seen a lot better cure rate and a lot better treatment response.
And you guys have recently invested in a cone beam CT. Could you share a little bit more about that and maybe explain for anyone who doesn't know the terminology?
Yeah, absolutely. So basically a cone beam CT is essentially a CT guided bronchoscopy. What it does is it allows us to do real-time imaging and 3D reconstruction while we're doing the procedure itself, which improves our yield to 95% or above when we biopsy any lung nodule. It allows us to keep that low risk that a bronchoscopy provides while giving the high yield that the CT-guided aspect of it provides.
And early detection obviously is important for all forms of cancer, but especially lung cancer. Could you talk a little bit about that?
Yeah, again, anytime we talk about any cancer whatsoever, the lower stage that we can diagnose and detect it at, the better the outcome. And so, unfortunately, lung cancer has no signs or symptoms until it's an advanced stage. Every stage 1 lung cancer has no symptoms of their lung cancer because the lungs don't have pain fibers. And so we have to look out for the signs and symptoms that will be caused later. So we look at risk factors, smoking, pollution, genetics, and everything else to guide us for that diagnosis.
And if somebody's listening this morning and this is maybe raising some red flags, what advice do you have for them?
Talk to your primary care doctor. They're the gatekeepers of everything. They're seeing you so much more often and easier to get a hold of. And talk to them about, if you're a smoker, about getting some, a low-dose CT scan, or talk to them about symptoms that you're having for further imaging and everything else.
All right. Well, thanks so much for this useful information. I appreciate it.
Yeah, not a problem. Thank you so much.
First Edition will be right back right after the break.